Alcohol, a staple in social gatherings and a source of relaxation for many, but at what cost to our health and well-being? First, let's answer one of the most important questions about alcohol. Does a safe dose of alcohol exist? The World Health Organization and other authorities recommend that women reduce alcohol consumption to no more than 1 standard drink per day, and for men, no more than 2 standard drinks per day. In the United States, 1 standard drink is typically considered to be 12 fluid ounces, or 355 milliliters, of beer with 5% alcohol content. 5 fluid ounces, 148 milliliters, of wine with 12% alcohol content. Or 1.5 fluid ounces, 44 milliliters, of distilled spirits with 40% alcohol content, e.g. whiskey, gin, rum. However, studies indicate that even this harmless dosage increases brain degeneration and the risk of cancer. So, alcohol is toxic for the body at any dosage. Let's review why this happens and how alcohol works. After ingestion, the first step is absorption. Alcohol is quickly absorbed into the bloodstream from the stomach and small intestine, with around 80% of alcohol being absorbed. The rate of absorption depends on factors such as food in the stomach, the presence of non-alcoholic drinks, and the overall health of the person. Alcohol reaches its peak concentration in 1 hour. After absorption, it is metabolized by the liver. Alcohol is broken down into acetaldehyde, which is then further metabolized into acetic acid and other substances. Ethanol, alcohol's main component, acts directly on the brain, but its metabolite, acetaldehyde, also damages DNA and increases the risk of cancer and other diseases. Alcohol is not fat-soluble, so it cannot directly reach the brain, but it still reaches the brain through passive diffusion. Alcohol increases the release of dopamine and inhibits the activity of glutamate, a neurotransmitter responsible for brain excitement. This results in a depressed central nervous system and feelings of euphoria, relaxation, and impaired judgment and coordination. Alcohol also enhances the activity of the neurotransmitter GABA, which slows down brain activity and causes sedation, relaxation, and impaired judgment. Glutamate is a neurotransmitter responsible for excitability and arousal, and alcohol inhibits this neurotransmitter, contributing to its sedative effects. The amount of alcohol, body weight, and sex also matter. Women generally get drunk easier than men due to their lower body weight, fewer muscles, and higher fat composition. By increasing GABA and inhibiting glutamate, alcohol disrupts the balance between these two neurotransmitters, leading to a slowing down of brain activity and impaired thinking, memory, and motor coordination. However, dopamine is a stimulant, so alcohol initially acts as a stimulant. But as more alcohol is consumed, it begins to act as a sedative, depressing the central nervous system and leading to slurred speech, unsteadiness, and drowsiness, ultimately leading to unconsciousness. Alcohol short-term effects. Impairment of cognitive and motor skills, leading to increased risk of accidents and injury. Dehydration and electrolyte imbalance due to alcohol acting as a diuretic and increasing urine production and fluid loss from the body. Decreased production of vasopressin, an antidiuretic hormone that regulates fluid balance in the body. Flushing, nausea, vomiting, and decreased appetite due to alcohol irritating the stomach lining and increasing acid production. Impairment of judgment and reduced inhibitions, leading to unpredictable and sometimes erratic behavior. Changes in mood, including increased relaxation. Now let's talk about long-term effects of alcohol and alcoholism. It causes chronic liver disease, including cirrhosis and liver failure. Increased risk of various types of cancer, such as liver, breast, and pancreatic cancer. Brain damage, including decreased brain function, memory problems, and difficulty thinking. Cardiovascular disease increases risk of high blood pressure, heart attack, and stroke. It causes gastrointestinal problems, including inflammation of the pancreas and ulcers. It can cause vitamin and deficiencies and increased risk of depression, anxiety, and other mental health problems. Alcohol causes addiction and increases risk of addiction on other substance abuse also. Frequent intake of alcohol causes alcohol addiction, which characterized by a strong craving for alcohol, an inability to control alcohol consumption, and continued use despite negative consequences. Also, alcohol also causes withdrawal symptoms, which means the symptoms that occur when a person who has been drinking heavily stops or significantly reduces their alcohol intake. And delirium tremens is a severe form of alcohol withdrawal syndrome characterized by confusion, intense tremors, and vivid hallucinations. And lastly, answer the question if a non-drinker becomes drunk easier compared to who drinks regularly. In fact, people who drink frequently may require more alcohol to become drunk due to their tolerance, but they can also become drunk faster if they consume the same amount of alcohol as someone who drinks less often due to their body's adaptation to the presence of alcohol. So, it's individual and there is no rule.